Oral Surgery Instruments by yours truly, Anna, Audrey, and Jennifer.
Okay, the mouth mirror. Functions: it provides indirect vision, retracts lips, cheeks, and tongue, and it can reflect light into the mouth. The mouth mirror is used on most tray setups.
The Dental Explorer functions to examine teeth for decay, calculus, and it also comes in different sizes and types. So the three most common ones is the Orban, the pigtail, and the shepherd's hook. And it's always mostly used on every tray setup.
The cotton pliers, the functions are to grasp, transfer items and or materials into and out of the oral cavity. Cotton pliers is used on most tray setups.
High-speed handpiece functions is to use with burrs to cut the tooth structure, bone, and remove decay, and to modify or remove restorations. The handpiece is ran by air pressure at a maximum speed of 450,000 rotations per minute.
The dental burr surgical 557 functions to form walls and create retention grooves in walls. And the difference between this and a regular 557 is that the surgical one is longer.
Mouth prop or bite block. The function is to hold the patient's mouth open during a dental procedure. The mouth prop can be used in any dental procedure. Ligate with floss for safety of patient choking.
Mouth gag. Function to hold patient's mouth open during dental procedures. A mouth gag is mostly used for oral surgery and periodontal surgical procedures when a patient is sedated.
The scalpel blade removal is used to safely remove blades from scalpel handles, and it's mostly used on oral surgery and periodontal surgical tray setups, and it removes all sizes of blades.
Towel clamp is used to secure surgical drapes and to secure plastic and rubber tubing to drapes. Pick up contaminated items and used in any procedure when face and head are draped to isolate surgical area.
The iris tissue scissors. The function is to cut and remove excess or diseased soft tissue. Tissue scissors are mostly used on oral surgery and periodontal surgical tray setups.
The Dean tissue scissors are used to cut and remove excess or diseased soft tissue, also used to cut sutures after knots are tied during suture placement.
Tissue pliers Anson are used to grasp and stabilize soft tissue flaps during suturing and reconstructive procedures such as gingival grafting, used on any surgical procedure requiring an incision and suturing.
The Allison tissue pliers are used to grasp and stabilize soft tissue flaps during suturing and reconstructive procedures such as gingival grafting, used on any surgical procedure requiring an incision and suturing.
The hemostats come in straight and curved, and they're used to grasp tissue or bone fragments, as well as to hold and grasp material in and out of the oral cavity. The hemostat is mostly used on oral surgery and periodontal surgical tray setups, and can also be used on restorative and many other ones.